Hi, this is Dr. Donald Fox, orthodontist and expert on how to get your child to stop thumb sucking, finger sucking, toe sucking, and binky pacifiers. Yes, there is technology out now that I've actually developed. I tripped over this 25 years ago, and it's in my new book called Stop Thumb Suck Revolution. It's available at Barnes & Noble, Apple, and Amazon, which also you have iBooks and also Nook. It's in digital and paperback. The purpose of this video today is to teach you the different damages that can be done by thumb sucking. Thumb sucking is supposed to stop at age 2. Even in the certain articles you may read on the internet, it says you can go up to age 5 with no problems. That's not true. I've seen this. I've been doing this for 31 years. I consider myself an expert in the field of number of people, not only that I've gotten to stop thumb suck, usually within 1 hour to 1 week, but all the damage I've repaired. And the damage has to be repaired starting at age 6 or 7, not age 10 or 12. If your child comes in with the damage done from thumb sucking or finger sucking, it's going to end up having jaw surgery. I'm going to tell you that ahead of time. This is not something you want the permanent teeth to come into the damaged area where the baby teeth were. So we're going to go over that right now. How does the damage occur? First of all, this is a mouth, and the mouth has a certain width across here and across the bottom. So when a child sucks, it's this muscle here called the buccinator. You can look this up, buccinator, goes in and it causes the mouth on the lower and the upper to get squished. And next thing you know, the mouth is too skinny and there's not enough room for the teeth. At age 6, then now the mouth has to be widened with certain devices. I use plastic devices that are economical, they don't cost as much, and they don't hurt hardly at all. A lot of people use fixed expanders. I disagree with them. The research says to stop using them years ago because they expand too fast. So I believe in slow expansion over a 5 to 6 month period. The second problem is that when a child puts their thumb in their mouth, here's the upper teeth, and then their jaw can't get to the normal place anymore. So now their jaw is back. And this actually, by putting the thumb in the mouth, keeps the jaw back. And now, even if you get the thumb out of there, the jaw will not grow out to where it's supposed to. Some people say it will catch up. No, once it's back, it's back. The jaw will not just grow out on its own. You need to make it grow out. There's devices also that do that. The next problem is, again, same thing. The child puts the thumb in the mouth, and depends on how they suck, they actually can push these front teeth up. And then some children, if they suck intensively, next thing you know, they suck, and next thing you know, the bone and the teeth are in the back are sucked down. So now we have another problem. So now I've already presented to you 3 or 4 different things damaged, and it's really disappointing because most of the 80% of the children come in and they have all the damages I just went over, okay? So to give you an idea about this, it's in my book, again, Stop Thumb Suck Revolution. It's available. You go online at www.stopthumbsuckrevolution. And again, you can see this particular child, we'll look at the top photo first, push their upper front teeth out, and then the back teeth in the back got sucked down. So this child had both. When it was all done, you can see the before and after, and this is one of the cases I actually treated. And I widened the mouth, and then I got the teeth to come down, and there were some other tricks. And that bottom photo has permanent teeth in it. The damage that can be done also in this particular photo is the mouth is real skinny and the upper teeth stick out. The bottom is the after result. And you can see the child's jaw is back on this photo. We didn't get it to grow out, and then they had teenage braces, and now the face got totally corrected, and this girl was very beautiful when she was finished. Not so lucky was a child who came in. We got him to stop thumb sucking, and you can see over here the jaw is way back. The teeth were all bucked out, sticking out. We call it buck, B-U-C-K. This patient had to have jaw surgery because by the time we got them to stop sucking their thumb, they were already a teenager and the bone structures were now permanently damaged. So at age 6 or 7, you want to bring the child in so that we can handle these particular problems. Not all orthodontists are trained the same to do this. Just because they went to orthodontic school, there's a lot of other training that you know how to correct these type of problems. I would say over half the orthodontists don't deal with early treatment. Then the other half of those, which now we're down to 25% of orthodontists, have formal training in early treatment at age 6. And then out of that, how many people have the real expertise? I've treated over 25,000 patients in 31 years, and over 7,000 of them were age 6. The number of thumb suckers I've stopped are at least over 2,000 patients, and most of them stopped within 1 week or less, and actually 50% stopped the first night when they went home with the actual techniques that are in this book. This book has 37 habit busters, how to stop simple thumb suck problems like a child's just doing it here and there, but if they're doing it day and night, there's some chapters in here that you sit down and read them to yourself, and then you can practice, you know, with a neighbor or something. You don't have to, but you can go right then you can have the book out right in front of the child, and just so you don't lose your place, do the techniques it says in the book, and the child will stop just as well as you were to bring them to me. I do one-on-one coaching with a child and take patients on to stop their thumb suck habits. My offices are from Deerfield Beach to South Beach in South Florida, and I welcome to meet you and your child, but particularly, hopefully the book stops the problem, and then we need to handle the damage. Please don't sit there and think this damage is going to go away. It is not going to go away, and it's really disheartening when you come in at age 10 or 11 and I tell you should have been here at age 7 when the treatment could have been totally reversible, the damages from the thumb or the finger sucking. Again, this is Dr. Donald Fox, www.stopthumbsuckrevolution, and I really enjoyed helping you or your child today with this damage and learning more about this problem. Thank you.